So I am going to be doing a PCA and a chest dressing for Mr. Tyson Ward. So I'm going to compare my physician sheet with my MARS. So I'm looking Tyson Ward, right patient, right drug, fentanyl, right dose, 10 micrograms per milliliter. Sorry, my nose. 10 micrograms per milliliter. Right rate, 5 minutes, and right time, we are going to give it right now. And 5 minutes is our lockout interval. So I've looked at the parenteral drug Monograph. It can be administered by a student nurse. And 10 micrograms in a 5-minute lockout period is within the normal range. So I'm just going to look here. So for my PCA, we are going to be taking two 50 microgram per ml vials, and I'm going to be taking 5 ml from each of them, and that'll give me my 500 microgram concentration or dose. And then I'm going to be diluting it in a 50 ml normal saline bag. I'm going to take 10 mLs out, so it'll actually be 40. So the very first thing I want to do is out.
So now that that blood infusion is done, now we are going to go ahead and move this chest tube dressing.
So everyone, you have about 10 minutes
Part
left
of my
in the building.
safety check would be checking to see if it is on continuous low suction.
So I'm just going to be cleaning this.
So it is
Clean for 30, let it dry for 15. And I'm going to withdraw that 40, or that 10 ml, sorry.
So I'm gonna go.
So that I have 40
So I'm just
remaining.
looking at your site.
And I'm just going to scoop and swoop this, sorry,
Semi-fouler. So I'm assessing
and throw this into my sharps container.
and coughing for any signs.
And I'm going to take my 2 vials here.
I am checking.
I'm going to clean for 30,
There are no coughs
let it dry for 15.
or loop. Assessing any breakthrough present, so I know
So I'm just going to be withdrawing a little bit here.
to check that, I'm going to be using my clamps. So first I'll check near here. I would see clamps, see if the bubbles stop. That would indicate that the air leak is here in the patient, and if it didn't stop, then I would just go along testing each segment. And that would just indicate, or when the bubbles stop, that would indicate that the air leak is present there, and then I would fix it. So part of my safety check would be making sure I have my safety equipment, so it's clamps as well as my sterile water right over here. So before I do this, I just want to establish his baseline, so I would get a set of vitals as well as a respiratory assessment. Oh, and part of my safety check would make sure that.
Alright, so I'm just going to clean for 30 again, let it dry for 15.
So we're just going to move your clothes out of the way, Jerry. Moving your arm.
Getting a lot of pressure in this container here. Alright, so over a sink or the garbage, I'm just going to push it up to the 10 ml. Perfect, so I'll show that to the camera there. And I'm just going to do my scoop and swoop. And I'm going to do my second check with my 2 vials. So I need my 10 micrograms per milliliter. So 10 micrograms per milliliter requires 2 50 microgram per milliliter vials. So these are them right here. So fentanyl, both 5 ml. So I needed 10 ml to create 500 microgram dose. So I have my 10 mLs right here. And I'm going to get a second nurse to come and independently double check this before I place it into my mini bag. So my other nurse comes, she says that it looks good, so I am just going to inject this in here. I'm going to clean for 30, let it dry for 15, and then I'm just going to inject it in here. Scoop and sweep, sorry. Alright, I'm just going to put my label on here. So this is my label. Has the dose and the lockout period on it. And a second nurse is going to go administer it. So we're going to make sure that she uses a tubing that is free of ports and that she is a carrier for it as well and that everything is properly primed. So I will leave this for my second nurse. And I'm going to get ready to go to the bedside and do my chest dressing.
So I'm
Here, so I'm going to walk into my patient's room, and while I do that, I'm washing my hands. I'm going to check and make sure that my patient isn't any sign of visible distress, and I'm just going to get them sitting up in about a semi-Fowler's position. Alright, typically I would want my side rails up, but I'm going to be doing my patient's chest dressing in a little bit. So I'm going to leave them as they are. I'm just going to check my suction. So it is on low and everything looks like it's connected here. Then that's connected there. I'm just going to check my oxygen, make sure that that's working. And since my patient does have a chest tube, I want to ensure that we have 2 forceps at the bedside and some sterile water. So just making sure again that this suction tubing is connected to my pleurovac. We're going to assess if there's any drainage on the side here. We want to make sure that it's properly labeled, and I'm going to make note of any color of the drainage. We're going to watch for any tidling here, so as they breathe in it'll increase, as they breathe out it should decrease. I want to see the orange ball here, which means that my suction is operating. And we're going to look in here, and this is my air leak chamber. So if there's not enough fluid, I do have some right here that I can put some more in. But as you see, it's bubbling quite a bit, so that indicates that we do have an air leak. So I have my forceps here for my chest tube. So I'm just going to move my patient around here a little bit. So my very first step is I want to clamp as close to the chest tube here as possible. And I'm going to assess if an air leak is still present. So there is no air leak present, which means that the leak is somewhere within the side of the patient. First thing I want to do is I want to change my dressing and make sure that it's fully occlusive. And if we still have an air leak after I change that dressing, then that indicates that there's a leak within the tube inside the patient, and I'll have to contact the physician to get that changed. So I'm just going to talk to my patient now. So how are we doing, Tyson? Just going to check his armband, make sure I got the right patient, so Tyson Ward. So I'm just going to let you know what we're going to be doing today. So I'm going to be doing your chest dressing. We also have a second nurse coming in to set up your PCA for you a little bit later. So PCA is a patient-controlled analgesia, so that's going to be for your pain, so that'll help you out there. So you're going to get a button, and you can press the button as many times as you like, but you're going to get a dose of pain meds about every 5 minutes. So whenever you're in that pain, you can hit the button, and it's going to prevent you from having an overdose or anything like that, because it will only give you a dose every 5 minutes. Do you have any questions? So this is where I'm going to take into consideration my patient's right to refuse the PCA. Just gotta grab this here. Alright, so I'm going to get myself all set up for this dressing change. Alright, Alright, so I'm not going to be using any of these, so I'm just going to place them to the side here. To the garbage, so I will pretend I have a garbage on the floor there. Just going to take this and I'm going to go tip to tip, making sure I'm aware of my 1-inch border there.
And I have date, time, and initialed it.
Alright. So I'm just going to add a little bit of stuff to my sterile field here. So I have some drain sponges. I'm going to need about 2 of them.
So now I'm just making sure that it's intact, it is adhesive. I would do my exit safety check. Part of that would just be to put him back into how he normally was. I just do my quick respiratory assessment, set of vitals. And again, just making sure
I'm going to add a couple extra 2x2s in here.
Just making sure that he's not in any signs of distress. I put the call bell in range, just clean up. I would document the procedure. I would document how the underlying skin looked. That it was intact. I would document the blood administration as well as the chest tube care that I have solved the air leak and that I have assessed the air leak.
And just one more, just for good measure here. Alright, so I'm going to add my sterile water, which appears to have gone missing, so I will ask my assistant to grab me my sterile water, thank you. Just got to put on some gloves here. Okay, so peel this back. Just going to pour it very carefully.
What happened? I don't know how to fix that. The first time
I'm just going to place that up there. So I'm going to take off the old dressing carefully.
Yeah, it went dark like this, and then it said there was an air bubble.
I'm going to be very careful not to dislodge the chest tube here.
I know, I'm like, should I say something? Maybe you can't see it. Did I miss anything for the second one?
There we go. And I'm just going to remove my Jello net there. So I'm going to assess my site and make note of any drainage that I had on my dressing there. So we're going to start by making a couple of rosettes. Try that. So I'm going to go in a circular motion. We're going to do 1 swipe per wipe. So drop that into my garbage here.
Oh yeah, I was like that. I'm like,
My rosettes are a little sad today because I'm shaking so much. It's okay. We're going to go a little bit further out here. And I'm just going to go just down the chest tube a little bit. Alright, now I'm just going to dry it. So I'm going to take a 4x4 here. Oh my gosh. Alright, that's fine. We're just going to dry around here. Alright, so first thing I want to do is I want to put my Jello net on there. So I'm going to open up my package.
do you guys have a blue cap? I'll take it. Thank you.
Grab my Jello net.
I don't know. It's
Wrap it up here. because I did clean around the site here, this is all sterile.
Oh, thanks, Trin. I got that.
Yeah. Denise?
Alright, so I'm going to take my gauze sponge here. I'm going to just take one of them for right now. Place that there. Set up like that. I'm just going to add a 4x4 gauze here.
Delaney, Christina, anyone who teaches it.
So just tidy up your bedsides and if everything's good, you guys can go.
Remove my gloves, and I would have removed my gloves and changed my gloves between taking off the old dressing and setting up the new dressing there. So I've already dated and initialed my dressing here just so that the other nurses know when this one was put on. Just gonna place my other one here, ensuring that my dressing is completely occlusive. And I want to tent my chest tube, just so that if there's any pulling, that it's going to be pulling on the chest tube and not anything else. Alright, so I'm going to ensure that my patient is back in a comfortable position. I'm going to lower the bed back down, ensure that they're okay, feeling alright. I'm going to clean up all my stuff, and I'm going to go document how the patient tolerated the procedure, any drainage on the dressing, the stoma site, if we noticed any redness, subcutaneous emphysema, etc.